I guess when I first found out that Deborah had RA, I was hopeful that it was just something that she would outgrow and they could take care of with medication and it would just go away, and it just never did. And it was just heartbreaking the first time I saw her. She had symptoms on and off from the time she was really little to the time we found out that she actually had it. And it finally just dawned on me how serious it was when she had I guess she had a little flu or cold, and she had a flare-up, and it was incredible how much inflammation she had in her knees. And she was just a little elementary school kid, and I was walking her from the parking lot to the school, and I saw her knee swollen, and realized how much pain she was in and how stiff she was, and how much it hurt. She says, "Daddy, wait for me, I can't walk." And that just, it really broke my heart. And I guess for a while there I was in denial that it was something that was going to be a lifelong ailment that she was going to have to deal with, that we were going to have to deal with her. And even to this day, I'm just hopeful that she's somehow going to outgrow it, or going to find something that helps her. But in the meantime, we've coped with it and dealt with it, and my wife's been really good about keeping up with the meds. Fortunately, she works in healthcare and is able to monitor it and make sure that she gets all her meds, and make sure that all her schedules and appointments are followed, and she makes all of them. And she has a very good understanding of what's going on. My role as a dad is just to talk with her and make sure we communicate, which sometimes I fail at that because we get so busy with life. But making sure I help with getting her to the doctor, and making sure she understands that she needs to follow her med schedule and things like that, and helping out when she has flare-ups. I can't tell you how many times I've had to carry her from the couch to bed because she can't walk, and just keeping on top of her about staying warm, keeping her hands warm, taking care of herself, and things like that, and talking to her about it. And I guess I try to encourage her to overcome some of her handicaps, I guess, by just pushing her a little bit. You can do it, Deb. You can go. Let's go get some exercise, or just work. You have a handicap, but you're going to have to overcome that, and you're going to have to keep up with everybody else. So you have to do the best you can. And we're not hard on her by any means, but that's what we try to do. And fortunately, she has more better days than she has bad days. So she's in fairly good shape relative to some of the kids that we've seen, and she does all right for the most part. Sometimes we forget that she's even sick, because there's days that she doesn't ever complain, and I know she's in pain, and I know she's stiff and hurting, but she has that attitude that we actually do forget some days that she has arthritis, and she's a normal kid. So what we're worried about now is that as she gets older, she's going to be on her own and having to deal with it as an adult, as a young adult. And we'll always be there for her to help her and encourage her and do whatever she needs. But more and more of what she needs to do is going to fall on her. And so we're trying to help her realize that right now, and get her on a routine and a schedule that she understands what's going on, and does more for herself as an RA patient. So that's about it in a nutshell. But we've had our ups and downs with her illness through the years, and we just cope with it.